Hi, I'm Dr. Avi Wallerstein, ophthalmologist and co-founder of LASIK MD. I'd like to thank you for entrusting our team with your vision needs. We have been providing laser vision correction for over 20 years, and that experience comes with a promise that we will do our best to provide you with the highest quality of care. Over the next few minutes, I will share a summary of what to expect on your surgery day. After checking in at reception, you will meet an eye care professional who will perform a series of tests to further validate that you are a good candidate for laser vision correction. Your eye prescription is measured and multiple images are taken of your cornea, the front surface of your eye. The important data we get ensures you receive the best possible results. Next up, you will spend time with our surgical counselor. He or she will walk you through our consent forms, answer any additional questions you may have, and confirm the cost of surgery. Payment is processed, and post-operative instructions are provided. You will also receive a kit that includes the after-surgery activity guide, a schedule of when to use your eye drops, and a pair of sunglasses to use after surgery. It is common for most people to feel nervous or anxious. A mild relaxant is available. It won't put you to sleep, but it does take the edge off. If you feel you need it, please let the surgical counselor know. During that time, there is more preparing and talking involved than actual surgery. Right before surgery, eye drops are instilled to numb your eyes. This ensures that the procedure is pain-free. What you do feel is a slight pressure when your surgeon gently presses down. You also feel water that feels cool when used, and you feel touch, but no pain. When you enter the surgical suite, you will be greeted by your surgeon, who reviews your chart with you one last time, finalizes your treatment plan, and answers any of your remaining questions. You will then lie down on the laser bed. We use tape to keep your eyelashes safe and off to the side, and a clip that keeps your eyelids open. You can go ahead and blink. It won't bother you nor the surgeon. Next is when you feel some slight pressure and then your vision goes dim or dark. This is normal and lasts about 15 seconds, after which the vision returns. There is nothing to see during this time when the corneal flap is created. This thin surface layer of corneal tissue, called the LASIK flap, is then lifted, at which point the vision becomes noticeably blurrier. Next is when the laser does its job of reshaping the cornea. When looking at the laser, keep focused on the green blinking light in the middle of 4 white lights. This is what you look at the entire time, even if it gets blurry, and it certainly does get blurry with time. Do the best you can. There is no danger of looking away or not looking at the correct spot, even when the laser is on. The laser will automatically track and make small adjustments following your eye movements. If you move too much, it will shut off automatically and only resume in the correct position. The surgeon may ask you to change where you are looking, preferring a better position. The laser has a soft clicking sound. During those few seconds of laser treatment, you will see lots of colors. I often tell my patients to enjoy the light show. During the laser treatment itself, there is a smell that people describe as burning hair. Of course, the laser is not burning anything and is actually not hot, but rather it breaks up tissue. It is these microscopic particles we can smell. After the laser treatment is complete, the surgeon repositions the flap with water, and at that moment, the vision becomes noticeably clearer. We do one eye at a time, and then all is repeated for the second eye. When you sit up, you will notice your vision is already better than it was before the procedure. Immediately after surgery, it looks a bit foggy. We call it underwater vision. The extra water inside the cornea gradually resolves, and you will notice your vision improving by the hour. Following the completion of your procedure, we will do a final check of your eyes. I will now explain what happens after the surgery. It's important to note that the day after the procedure, the majority of people have vision good enough to do most things. In the course of healing, it is common to feel some mild burning, which is sometimes described as a sandy sensation, or the feeling of a dirty contact lens in the eye. It lasts a few hours and will likely fluctuate over the course of the day. It often improves with teardrops or keeping your eyes closed. You should try to keep your eyes closed as much as you can right after surgery. The most important thing is not to rub or touch your eyes the first day. The sunglasses we've provided in your kit will help protect and serve as a reminder not to rub. You will need to wear them the rest of the day, then overnight on the first night, and anytime you're outside for the following 2 days. Avoid strong winds or an extended period of time outdoors the day of the procedure. Avoid water getting into the eyes from a shower the first day. For the first 24 hours, please minimize the amount of reading, TV, computers, or cell phones. These activities make you blink less frequently and therefore dry your eyes more, leading to some discomfort after extended periods. Some people may be more sensitive to light over the next day or two. You may notice spots of redness on the whites of the eye. This is not something to be alarmed by. It is simply mild bruising that many patients experience. It is not painful and will not affect your vision or recovery. As with any bruise, it will fade and disappear over the next couple of weeks. We recommend that you do not drive until after your next day post-operative appointment. The first few days after your procedure, your vision may fluctuate and you may notice moments of blurriness. This is often related to surface dryness and is expected. Please follow the post-operative eye drop schedule that will be provided by the surgical counselor. In all, there are 3 to 4 different drops depending on the procedure you will be undergoing. Please wait 5 minutes between each type of drop so each has time to take effect before the next one is introduced. None of the drops need to be taken overnight, so you'll be able to sleep without issue. If you experience an emergency beyond what has been described, feel free to contact us on the patient support number that will be provided by the surgical counselor. The LASIK information booklet that you received prior to your preoperative consultation contains more detailed information, and we ask that you please read it prior to your procedure. If you have any additional questions, feel free to ask any of our eye care professionals. On behalf of LASIK MD, we look forward to seeing you and thank you for entrusting us with your vision care.